Hello all, this is chapter 25 video review. This chapter includes mycoplasma and ureaplasmas. So let's talk about mycoplasmas first. Mycoplasmas are the smallest self-replicating organism in nature. There are 3 species known to cause human pathogenesis or disease, and that is Mycoplasma pneumoniae, Mycoplasma hominis, and Ureaplasma ureolyticum. So some general characteristics about mycoplasma. They are pleomorphic, they lack a cell wall, and because of this they're also known as cell wall deficients or CWDs. They're slow growing, highly fastidious, facultative anaerobes. They require a complex media that contains fatty acids and cholesterol for growth. So they're slow growing. Some are more slow growing than others. We'll talk about that when we touch on each one of these organisms or species. On a solid media, mycoplasmas will produce colonies with a center that's embedded beneath the surface, giving this characteristic fried egg appearance. So when we talk about mycoplasma, associate a fried egg appearance with that, with that word. So to cause disease, these mycoplasmas adhere to the epithelium of the mucosal surfaces in the respiratory tract or in the genitourinary tract. They're not eliminated by mucus secretions or urinary voiding. So they're an epithelium adherent. So let's talk about the 3 species, the 3 mycoplasma species, or the 2 mycoplasma and 1 ureaplasma. So the first one we're going to talk about is Mycoplasma pneumoniae. This causes bronchitis, pharyngitis, and primary atypical pneumonia. This is your classic termed walking pneumonia. It causes about 20% of pneumonias in the general population and up to 50% in military settings. So the fact that people gather or in tight quarters can increase the rate of this infection. School age and young adults are especially susceptible, and others at risk include those closed-in populations, and that's I already mentioned military, but also dorms and prisoners. Those can be included in that. And transmission is through aerosol droplets, primarily produced by coughing. Many infections are asymptomatic or mild, so no, it can be transmitted fairly easily. Let's talk about the second organism, Mycoplasma hominis. This is associated with opportunistic genitourinary tract infections. It can be transmitted from mother to fetus during delivery. It's found primarily in the lower genitourinary tract of approximately 50% of healthy adults. So it can be a normal colonizer. It's not reported to cause non-gonococcal urogenital infections, but this particular organism can also, just like gonococcal urinary infections or urogenital infections, this organism can cause salpingitis, pyelonephritis, and can also lead to pelvic inflammatory disease. The third organism of discussion is Ureaplasma ureolyticum, and as with Mycoplasma hominis, it's associated with genitourinary tract infections. It too can infect a fetus at delivery. It does also colonize the lower genitourinary tract, up to 70% of men, 45% of women. So it's a more common normal flora. And just a note, this organism, Ureaplasma ureolyticum, is the most common organism isolated from tracheal aspirates of low birth weight babies with respiratory disease. So interesting fact about that one. So let's talk about collecting for culture and transporting it. All mycoplasmas are extremely sensitive to drying out because they lack that cell wall. So transportation and collection are important and crucial in order to recover this in the laboratory. Usually there is an appropriate medium to use for collection, and if it's not collected and set up immediately, it can be frozen at -70 degrees until plating is possible. So recovery with this organism can take up to several weeks. Mycoplasmas can be recovered from the blood. However, important note, they are inhibited by SPS. And if you recall, SPS is sodium polyanethol sulfonate, which is the anticoagulant in blood culture bottles. So if this is suspected in the blood, you would need to collect it maybe in a syringe and not put it into that blood culture bottle, or use some other kind of a blood transport bottle that lacks SPS. There are a few media specifically designed for mycoplasmas. I think Mycoplasma hominis is the only one that will grow on blood and chocolate. So some of these others are necessary for growth of other organisms in these groups. But the most commonly used is SP4 agar or broth. And then there's another one I want to mention, and that's New York City agar. And Ureaplasma uniquely requires liquid medium with a pH of 6.0. And because this one is so particular in its requirements, that it's very difficult to recover. It's very difficult to culture. Because it rapidly dies after it depletes all the urea that's in its medium. So after we do isolate a mycoplasma, we can identify it. There is a particular stain that can be used. It's called Dean stain, and this makes that fried egg colony blue with a dark center and a light periphery. Mycoplasma hominis colonies can grow in 2 days, whereas M. pneumoniae might take up to 3 weeks. So these are kind of, they vary in the amount of time it may take to recover, or grow, or to culture. So how do we diagnose these? How do we test for them other than growing in a culture? Serologic diagnosis includes the cold agglutinin antibody titer. This has been used for many years. It was used for primary atypical pneumonia detection. However, it's not sensitive or specific, and only 50% of patients with primary atypical pneumonia produce this detectable cold agglutinin antibody titer. So really, a demonstration of a significant rise in antibody titer plus culture isolation is preferable for definitive ID. But there are some others that are used in the laboratory, and that includes complement fixation and an enzyme immunoassay test. And the enzyme immunoassay test is the preferred method that we use now. It's the most common. Let's talk about susceptibility with these organisms. There's no agent that is mycoplasmicidal for M. pneumoniae in particular. But erythromycin, tetracycline, and Biaxin can shorten the duration of symptoms and help a patient with respiratory infection recover. 2 notes. Mycoplasma hominis is resistant to erythromycin and sensitive to lincomycin. And oppositely, Ureaplasma ureolyticum is sensitive to erythromycin usually and resistant to lincomycin. So 2 little notes. And that's all. Pretty short, abbreviated section on mycoplasma and ureaplasma.